Good evening, and it's great to have you with us here as we near the end of another week together. And we begin tonight with that FDA advisory panel today approving a plan to offer Pfizer booster shots to millions of Americans 65 and older, or Americans who are at high risk of severe COVID 6 months after that second dose. That same panel rejecting boosters for all Americans 16 and older, saying more data is needed. So they're starting with 65 and older and Americans who are at high risk first. Of course, this all now goes to the CDC next week. The president had said that all Americans should be prepared for boosters starting September 20th, 3 days from now. But the White House says that that was always pending approval from the FDA and the CDC. It comes amid those numbers tonight, the U.S. averaging about 146,000 new COVID cases a day, the country with about 2,000 deaths in just 24 hours for the second day in a row now. 8 states tonight now with ICUs at 90% capacity. So the question tonight, what does this likely mean for Pfizer boosters going forward now? Dr. Jha standing by to answer your questions. And what about the other 2 vaccines? I'll ask him. But first, ABC's Whit Johnson leading us off tonight.
Tonight, an FDA advisory panel voting unanimously to authorize Pfizer booster shots for Americans 65 and older 6 months after your second shot. They also voted to authorize boosters for Americans who are at high risk of severe COVID at any age, such as people with diabetes or high blood pressure.
We do have a unanimous 18 out of 18 who voted yes. Dr. Cohn, yes. Dr. Portnoy, yes. Dr. Lee, yes.
The panel didn't officially vote on it, but also unanimously supported, including healthcare workers on the front lines, teachers, and essential infrastructure workers in the first wave of boosters. The FDA could potentially include more groups incrementally as more data comes in. The move comes after Pfizer pointed to data from Israel showing that booster shots given to people 60 and older cut the risk of infection by 11 times and severe infection by nearly 20 times. Just hours earlier, the same panel had been asked a much larger question. Should boosters be available for everyone, 16 and older? The panel overwhelmingly rejected that for now, indicating more evidence is needed.
Dr. Perlman voted no. Dr. Gans voted no. This vote did not pass since the majority voted no.
Despite studies indicating vaccine protection wanes over time, today panel members voicing concern over the lack of data showing the impact of boosters on young people.
There are too many questions for me to feel comfortable saying yes.
I think that we need safety data for younger populations, and we need to really know what the benefit is. I think so far we've got some reasonable data for older people, but I really think that there are too many questions on the younger populations.
Today's decision comes after the president's plan unveiled in August to roll out booster shots for all vaccinated adults starting September 20th.
Get a booster shot. It will make you safer and for longer, and it will help us end the pandemic faster.
Facing criticism for getting ahead of the science, the White House defending itself, saying this was always pending FDA and CDC approval, and they continue to say they're ready when given the green light. So boosters will likely now begin in stages, starting with 65 and older and those at high risk.
If you want to roll out booster shots to the population, you can't flip a switch and make that happen overnight. There's important planning that has to take place.
So let's bring in Whit Johnson back with us tonight. Whit, I know this goes to the CDC next. So bottom line tonight, what's the timeline here? And when could Americans 65 and older and Americans who are at high risk be getting their boosters?
David, a CDC panel will be meeting next week to consider more specific guidance about how these boosters should be rolled out. If authorized, we could start to see those shots going into arms by late next week at about 80,000 locations across the country, including pharmacies. David?
All right, Whit Johnson, we'll see you right here this weekend. In the meantime, we know many of you at home have questions about booster shots. I want to bring in Dr. Ashish Jha, Dean of the Brown University School of Public Health. Dr. Jha, always great to have you with us. So you've been saying on the air here with me for some time that older Americans and those at higher risk of severe disease should receive the Pfizer booster first, which is what the FDA panel has just recommended today. That still makes sense to you based on the science revealed?
Yeah, good evening, David. Thanks for having me back. It does. The science on this is very clear. High-risk people, older people. Yes, younger, healthy people, we don't have the data, and I'm glad that that's how the FDA voted.
So on that larger question of whether all Americans 16 and older should receive Pfizer boosters, you said evidence is needed, further evidence, the FDA panel saying the same thing. We saw Israel starting with 60 and older. This was back in July. Then they moved to 50 and older after more data. Is that likely what we could see here, an incremental rollout as we move forward?
Absolutely. I think we're going to get more data on that younger, healthier population. And when we do, if it shows that those people need boosters, then I think that's where we will go. But right now, we really do need to focus on that high-risk population. But over time, yes, I do expect younger people to probably end up needing a booster.
I try to remember, Doctor, what people at home want me to ask every night. And so if they didn't get the Pfizer shot, if they had Moderna or Johnson & Johnson, bottom line tonight, Moderna hasn't applied for booster approval yet. And what about the one-shot vaccine?
Yeah, I think Moderna is going to be coming in terms of the booster authorization probably in the next 4 to 6 weeks. They have submitted some data to the FDA. Johnson & Johnson may be a couple of months away yet. They just got their approval later. So we're going to have to hold on a little bit longer for J&J.
All right, Dr. John, a Friday night. Thanks so much. We'll see you next week here.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.